Evening and very good morning for those in Europe. I'm Rumpet Chitanuwan. I will be the moderator for today. Welcome to the webinar week for CPhI South East Asia. This is our first time follow from the EP2 that we focus on the packaging for the elder products in pharmaceutical by professor from Thailand. So today we have our honorable guest, which our webinar today will focus on 10 key things for packaging design for the pharmaceutical products and the herbal products. As we all know that in ASEAN, a lot of herbal products also developed for the treatment and the prevention of the disease. Of course, definitely there is a lot of what's happening in around ASEAN in Indonesia, a lot of young people. So the children need to have the user-friendly packaging design. And also in Thailand, we already step in the aging society for this year and will have more of aging people. So the packaging for the products like the medicine is very important. You have to develop the products that the kid cannot open it easily, but it's easy to use by the adult or elderly. So today the webinar is supported by the Thailand Institute of Science, Technology and Research under the Ministry of Higher Education, Science, Research and Innovation, and also have support by the Department of Medical Science. We get advice from them on the topic that we are going to bring into this webinar week of CPhI Southeast Asia. And our honorable speaker and they are our supporter for the CPhI Southeast Asia exhibition, Thai Packaging Design Association, T-Cells, Thailand Center of Excellence for Life Science, and definitely we have our honorable supporters today, SCG Packaging. So let me bring you into our CPhI Southeast Asia webinar week today. There will be altogether 3 days. So tomorrow we also have another topic I will promote to you lately. With the condition of social distancing, CPhI Southeast Asia has been moving from March now July, and then with recent date we announced on 4 to 6 of November. We are expecting the good news from the government and welcoming our exhibitor and visitors toward the November show. However, we are going to update you on the situation of the show lately. For those who want to join our digital platform to promote your products, to engage with the community, you may contact Informa Markets team for more information. Okay, so now it's time to enjoy your listening to our guest speaker. She's very well known and she is an expert in the design packaging. So may I introduce to Miss Wanna Sutatna Ayuthia. She is the president of Thai Packaging Design Association, and she is also a leader in innovation management leader of SCG Packaging. She is also advisor of Packaging Association. May I now introduce Khun Wanna to start her presentation, and let's stay with us for next 45 minutes. Enjoy your presentation and enjoy your knowledge about the packaging design. Welcome ค่ะ Khun Wanna.
สวัสดีค่ะ Good afternoon, everyone. Today I'm gonna talking about 10 key things for packaging designs for pharmaceutical and the herbal product. So as you know that the packaging design is talking about the 5 transactions. The first one is attention. So how we do designs to acquire the prospect, the interest in your brand or in your product. And the second one is about the engagement. So build the designs towards the purchase. And the third one is purchasing. It means the action. And the fourth one is loyalty. When they buy it and then came back and then to buy your brand again or your product again. And basically, this is beyond the loyalty. That's all influence the other, like word of mouth to tell the other one to buy the product. This is like the package design for in general. But the packaging designs for the pharmaceutical and herbal product is quite a bit different from this one. But before go to that point, I will talking about the beyond COVID-19. The next normal for packaging designs, we're talking about the 5 theme issue that will shaping the packaging industry in next 10 years. This is the information from McKinsey and Company that the first one is about the e-commerce everywhere. As you know that after we lock down, each country locked down all the country. We cannot going out and then we cannot travel or kind like that. So e-commerce was very booming. And if you look at the trend impact, they moving from moderate to very high, very fast. And see that all the most likely is sales and buy via e-commerce channel. And the second one is about the change in consumer preference, and so it's changed a bit to the very high zone area. And the third one is fast moving goods, consumer goods, and retail margin is very compressions. And the fourth one is about sustainability with hygienic. And the last one is about the digitalization and Internet of Things. So we will have a look one by one. The 5 major trends that could change the packaging industry in next 10 years. The first one is about the e-commerce everywhere. This will like significant implication for packaging designs because today the packaging has been like optimized for traditional like brick and mortar requirement, not online packaging. So if we design the packaging for the online, we have to put some consideration in our designs, like shock vibrations and all things that to look at all the supply chain from the factory until to the end user, how they transport from the distribution also to the whole house or each consumer home, some kind like that. So it's quite different on the e-commerce packaging. And as you know that, everyone can like purchase the product or the service via the mobile phone. So everyone, even like the kid, also purchasing online. So this is the new trend after the COVID, and this trend will go until up to now, and I think in the future also. And the second one is rapid change in consumer preference because for the next normal, we expect that consumer to go on being very price sensitive. And this, I think, but the other one is the consumer preference will focus even more on health and hygienic. Let's have a look at the consumer insights. This is like before the COVID. The consumer insight is about, they're talking about the convenience. Everyone an expert, because right now, when people, when consumer want to buy something, they are research the information from internet and online and or even many channels. So after that, they will like summarize the information and then decide to buy it. And the other one is about personalized. So everyone would like to have a personalized packaging or personalized product for themselves. So like each one have a very personalized issue for them. So the design will be like personalized. So the packaging designs which serve this kind will be like digital printing, kind like that. So can print their name on the package, kind like that. From the age agnosis, because right now the they talking about the aging population, because the growth rate is decline a lot even in Thailand. So when we do the packaging design, we have to concern about this one also. And the other one is digital together and loner living. Loner living is because I think in Thailand, most people get married quite late, and someone like lady get a very high education, so they get married late, and someone get married but still don't have kids, kind like that. So a lot of people work in condominium, say near the MRT, kind like that. So, and after the COVID, the consumer insights changed a little bit on the they like hygienic. People be talking about the hygiene a lot and protections, even like in the cosmetic industry. Normally before COVID, they talking about how to make it like beautiful, charming, highlight that. But after that, they're talking about the protections. And safety also is come up after the COVID. And there are two, which is everyone and expert and digital together is become more important on that one. So this is overall of the consumer insight. So when we do the design, we taking this into account also. And the third one is about the changing in cost pressure and also some more on the regional supply, because so this one will affect to the packaging. So most of the packaging designer offering like the substitution of the different packaging material and go for the lightweight but same strength, even like all the material for paper, for plastic, for glass, or for metal also. So they go for lighter and but stronger, kind like that. Or even like the redesigns for the package design to increase the filling efficiency. So the designer will collaborate with the packer to work with the packer in order to like eliminate some process and then change the designs, and then maybe use less material or kind like that, or even like increase the volume density, and some is smaller pack size, because you can see that in the market. Some packaging is quite big, but actually the volume is less. So this I think for the sustainability designs, this one will be get smaller and smaller. But for the smaller pack size is coming from because of the small family also, and also the aging society also. So almost of the packaging will reduce the size according to that trend also. And the other one is about the shelf-ready packaging. This one will do the will change the cost very effective, and because beside of this thing is about the when you transport and put the product in the packaging, but when the packaging go to the supermarket, this one can be display also. So they have like 2 or 3 more function on display on the shelf. So this one also could be reduce some price also. So some packaging design to reduce cost. You can see that the most popular brand like IKEA or many brands that they use the design to reduce material, and this one will sure reduce the cost of the packaging also. So this one will be like effect to the cost pressure from the brand owner also. And the fourth one is about the sustainability. Everyone talking about the sustainability, talking about the packaging waste, kind like that. So, but for during after the COVID, we talking about the sustainability together with the hygienic concern. So they will think about the material and how to like to think about the circular economy. So it's not a linear. So just like use and then dispose. So if circular economy, it could be a circle. So it can be recycled again and again. So, and the last one is about the digitalization, because among the value chain, this because this one can be tracked, trace, and control for the packaging. This is for the safety and also to increase the value in the value chain through all the supply chain. So they have technology to use in the package design. We call it like use the RFID, is radio frequency identifications, or even like near field communication also. This one can use track, trace, and control. But for the pharmaceutical and herbal product, we use it for monitoring also. I will give you a sample later about the smart packaging. So any packaging that launched during the pandemic in the near future should take into account three important requirements. Let's have a look at the three major requirements. The first one is about the sustainability. Everyone talking about the sustainability. Everyone stay at home, so sometimes we purchase food and purchase everything and then deliver at home. We could say that there are a lot of packaging waste. So this is one of the major things that designers should think about that one. The second one is design with hygienic in mind and consumer safety concern also. This is very important because after the pandemic COVID-19, everyone talking about the hygienic, about the safety, about the protection. And the last one is about the design for e-commerce. So talking about the total supply chain, we talking about like total holistic packaging designs. We start from choose the material, designs until production, and send to the packer, and then go to the consumer, and then return back. So this is the one that we're talking about. And this one is about the packaging from SCG packaging that we did it for the deliver for the medical. For we share with all the hospital in Thailand. That means during the COVID-19, everyone, the patient have to take medicine also. So the hospital just send the medicine to the patient home. So this is our activity during the COVID, also about the packaging for pharmaceutical. So let's talk about the packaging design for pharmaceutical and herbal product. I will talking about the packaging actually must be clear reflection the personality of the product that contain, and actually it will cause a very great visual impact. Let's have a look at the 3+7. I'm talking about 3+7. The best 3 is reasonable cost and convenience and performance. This is like the basic need of the packaging. So a reasonable cost is okay. So not too high and not too low, but the quality must be good also. And convenience, there are a lot of the convenience for the pharmaceutical product, how to open, how to close is the packaging, okay, like that. I'll be talking about that later in universal design. But the fourth one is about the containment of the product. This is a special type of the packaging which prevent leakage and spilling, because pharmaceutical packaging design is quite different from the other like FMCG or consumer product or durable good, because it's very high level, and the design and the material had to be comply with FDA requirement. You can see that at the left side. Is the packaging, the primary packaging most likely is plastic and also the glass. So you can see that they ship from glass to plastic, some kind, most likely is like that, from glass to plastic and to blister, like that. So you can see, and even like this one is a Thai herbal. So the design have to be containment of the product. This is the must be key things in package design. And the next one is about the maintain drug quality. It's very important because drug also have the lifetime, and drug cannot does not last forever. Maybe some drug maybe have lifetime about can expire 1 year later or 2 years or 5 years. It depends. So the quality of the product is must be we must be designed like proper packaging. This one is include the design and also the material also. So this one could extend shelf life of the and can maintain the quality of the drug and all the medicines product. And the next one is about the content importance, so storing and dosage information. This one will prevent overdose because all the package design for the pharmaceutical and herbal should contain details such like how many pills can take a day, a week, okay, like that, and have explanation about the if containment of the information of the ingredient, okay, like that. So you can have a look at this one. Some herbal product, we recommend to put a picture of that kind of the herbal into the packaging, like that, and also the dosing information like the weight and the age of the patient, how much that should take, okay, like that. So this one will prevent the overdose for the patients. And the next one will be the protecting against the external damage factor, because there are many factors that could damage the medicines. Some kind like moisture, insects, or pests, kind like that. So this one should be proper choose or design about the material and also the design, how to close and how to seal at the packaging during transportation or handling. And the next one will be very important for the pharmaceutical design, package designs. It's about the preventing child access, because this mechanism will be maybe used for push and pull or push and turn, okay, like that. Or some folding carton had to place two point and then release the pill out. So like that, this will prevent the child from taking the medicine and then eat it, kind of like that. And the next one will be the appeal to target market. The design should like appeal to the target market. Like if we target the kid, so we may take some design for the kid, or even like colors, kind of like that, or some for aging or for the elderly, or even like some part of the body, we can use the illustrate to show the so this one will be like the both to serve the practical and decorative purpose also. Or even like this one will show how it gonna be look like and used for which part of the body. So this one will appeal to the target market very clear, and then the consumer will choose it right away. It's kind of like that. So the last one we will be talking about the FDA rule. That will be the Annex 9. We're talking about the guideline on packaging for pharmaceutical. In Thailand, we call it อย สำนักงานกรรมการอาหารและยา but actually when we export or we sell it internationally, it have to be compliant with the FDA. I will talking about very short about the FDA rule, about the function of the packaging. We're talking about the containment protection, and even like the regulation about the presentation and information about the label, repacking, relabeling, some kind like that, and even cover to the package insert for patient also. And also include the compliance protection of the patient and the counterfeit also. This is very important for some medicine that have a very high price and very limited for user. And the next one is talking about the material, talking about the type of the material, glass, plastic, and metal, and closure, also rubber closure or cap, or special type of the closure have to comply with the FDA approved. And the third one, we're talking about the Q&A, quality assurance. We'll be talking about how the quality control and also how they're gonna sampling and also testing program. And also the inspection and audit, they have the rules and audit of the supplier. And the fourth one is about the protection of the environment. They're talking about the packaging waste and also waste policy. And the fifth one is about the qualification of the quality of the specifications about the packaging material and also the requirement for doses from container that I'm talking in the first few slides. And they're talking about the pharmacopoeia requirement for container in Europe, Japan, and in USA. So in each country, we've got some different ones. So we have to study about that kind of the regulation also. And also have to be compliant with the international standard also. So the next normal will like we put the packaging design to spotlight, and this one will evolve with the mega trend, and this one will reshape the pharmaceutical industry and also many in business that relate to the pharmaceutical and also even like herbal product. And the other two areas that I would talking about is related to the pharmaceutical and herbal product. It's about the like innovation on the this industry. It's about the smart packaging. Because when we are talking about the smart packaging, it could be like interactive with the user. This one could be used for track, trace, and control. They put some like AR, it's called like connected packaging. Actually, for AR, this is being used in like in many packaging industry, in designs, some kind like they use for like storytelling, or some kind they use the AR for like supplies or delight the user. But for pharmaceutical, some kind they use for like give the informations to the user. We can and also some smart packaging can be like beside of the trace, track, and control, you can use it like a health monitoring because some drug you have to continuous consume it every day or every 2 days or 3 days or every week. So this kind of the technology will help the user. And the last one will be about the universal design for the pharmaceutical and herbal package. When we're talking about the universal design, we're talking about the 9 element. It's talking about the identify, hold, to take out, to use, to open, to dispose, to store, for safety and for understanding. So it's come up with the 9 elements for the universal design. For the pharmaceutical product, this one is easy to identify. So they use the technique of the blind embossing into the folding carton to let blind people know that what this is what is the what kind of the medicine or kind like that when they purchase it. So it's widely used in all over the world actually for the blind on the package medical packaging. And or even like this one, yeah, there are many kind for the most likely as far as I saw that mostly is we're gonna print and emboss on the folding carton for the secondary packaging, because actually when we do the design for the pharmaceutical product or herbal product, we divided designs into like primary packaging or secondary packaging, and the third one is tertiary packaging. Mostly the primary packaging will be contact direct to the medicine. The second one will be it could be like the unit, all the primary packaging together. Some kind like the primary packaging would be a glass bottle. The secondary packaging will be the folding carton or kind like that. And tertiary will be like corrugated box that comprise the more unit, like 20 or 40 bottle or box in one package. But mostly for the universal design is they did it on the secondary packaging, that's folding carton. So in summarize, I would say that there are 9 elements that we're talking about the package design for the pharmaceutical and herbal product. The first one is reasonable cost. So this one, the designer should be thinking about how to design not over or under the requirement of each product. I mean, each product mean from medicine or even like herbal product. The second one is we're thinking about the convenience, how people use it. So it's quite convenience to take out, to use this kind like that, or even like convenience to dispose is also taking into the account of the package design also, because we're talking about the holistic packaging design. So the designer should think about from the first action, that means design, choose the material and shape and form and functions like that, until to dispose the packaging also. And the third one is about the performance. The performance talking about the strength and how to protect the product inside. So each product got different criteria, because some pharmaceutical product is a liquid, some is a tablet, so some is like the powder. So it depends. So we have to think about that one. So the fourth one is about the sustainability with hygienic concern. So after the COVID-19, so everyone talking about the sustainability and hygienic, also the protection also. So even like on the FDA Annex 9, they're talking about the packaging waste from pharmaceutical also. So we So we do the lighting at the first time. So the package design, we gonna choose is bright light quality, and the light material and the light designs. And the fifth one is design with the hygienic in mind, consumer safety concern also. This is very important because for the medical product, we serve all range of the consumer from kid, from like the kid until for the elderly people. So this one we have to concern about the safety concern, like the testing, how to take it out, like that, because some elderly people cannot use very strong hand to take it out, like that. So this is one of the concern also. And the hygienic, we're talking about like how to preserve the medical or herbal product inside the packaging designs also. So we have to choose the right material for that one. And the next one, talking about the prevent child access. This one, I already talking about like how to prevent the child for accident when they take out some medicine or some tablet on the product. And the most important is FDA rule. So it must be past the regulation of this one in case. And the next one will be universal design, because this one we take into the account of the package design always. And the last one is smart packaging, which is the trend and innovation for pharmaceutical and herbal product to have like some storytelling or some information that interactive with the consumer. Also for monitoring and trace, track, and control for the pharmaceutical industry. So in summary, when we do the designs or even like we entering to the pharmaceutical industry, we keep update with the latest technology to remain competitive. And the second one is the sustainability is the key in the future. So everyone talking about the material that should be like sustainability, could be recycled, biodegradable, some kind like that. But the biodegradable for material for the pharmaceutical have to be compliant with the FDA regulations. And the third one is about the innovation throughout the supply chain. When we're talking about the innovation for the pharmaceutical product, so we look at the whole total supply chain from user until the producer, and also all among the supply chain that will make a great innovation in the industry. And the next one is will be keep close to the end user and the brand owner or even like supplier, because they like end user may have like some change or preference. So or even like behavior change. So we keep update with them. Or even like some brand owner or supplier, sometimes they change the format of the packaging. Sometimes they would like to add more, or sometimes they would like to have less. So this one will be good if we keep in touch with them for this change. And the last one is about the collaboration. Because when we do the package design, we have to collaborate with among the network in order to create a new product or even like a new market, kind like that. So sometimes the packaging designer have to keep close with the material producer or even like the machine maker. So many things that they should collaborate together, because sometimes we need support from each other. So this is all about the 10 things that about the package design that should talking about in today. Thank you very much. Thank you.
So thank you very much, Khun Vanna. Now we have few of questions coming from the live chat. So in order to summarize from what Khun Vanna shared with us, I think most of the audience already the packagers and the audience who are already specialists in the packaging industry. So with the pharmaceutical, what I can summarize here is no compromise on product safety, because it's like it is the overriding principle for the products for pharmaceutical, that the responsibility of the producer to use the packaging is actually on the human health, which is not compromised on the safety itself. So I would say that for the CPhI Southeast Asia, we will bring the knowledge to the audience more and more on the smart packaging. That is very interesting. If you remember from the medicine you have bought, nowadays it starts to have the smart packaging already. Otherwise, you need to uh, enlarge the font on the instruction, or even how to use the products. Okay, so now come to the question, Kun Vanna. So the question from the registration first, I think the question was sent before we have this session. After customer registration, they want to know it's any update on the opportunity of the bioplastic for pharmaceutical industry. Is there any opportunity? As you said in the very last sentence, that it has to comply with the FDA regulation. So this question is from Indonesia audience actually.
Hi. Okay. Thanks for the questions. Very good one. Actually, for the bioplastic or even like for the biodegradable, it must be very comply with the regulation. But as far as I know that there are many companies study about this one, because they the study is about like they use the still in petroleum based or even like plant based to reduce how come to reduce the lifetime when they could be recycled, maybe like 40 years until like 10 years, and then they can degradable or kind like that. Yeah. But this one have to be comply with the FDA. So and the most important, as far as I told you, that it must be like maintain the quality of the medicine as the lifetime of the medicine also.
Yeah. So the bioplastic packaging, we have to consider whether you are going to use for the primary or secondary for the product itself. And the most important, check your FDA. Okay. So the next one is the question from audience also. What is the packaging innovation for the degradable herbal products?
For the degradable,
I think they must say that the innovation that to be used, the degradable packaging innovation that to be used with the herbal products. I don't think it's degradable herbal products. Yeah.
I think so.
Yeah.
But actually, it's like this the first questions about the degradable, biodegradable, right?
The audience was mentioning about the degradable only. I would say like they are looking for the alternative for using with the herbal medicine.
Oh, right. Yeah. Okay. So as far as I know that they have a kind of the study about this one also, but for the herbal product is like the regulation is not so high as the pharmaceutical, like drug or medicine. So I think you keep an eye on the supplier that they study about this. I think you have to study about your product first, and then choose the material that could be like degradable. Yeah.
Yeah. So I would say that this back to the regulation of each country itself. For example, in some country, the PICS that implement with pharma is cover herbal also and cover the medicine. But in some country, the herbal can be treated separately.
Yes.
So the rules and regulation is the compliance very important. Okay.
Yeah.
So come to next question. What about the protective packaging? The audience is actually from Indonesia. They want you to share about what about the protective packaging in perspective to use with pharmaceutical.
When you're talking about the protective packaging, there are, as I told you that the packaging is primary packaging, secondary packaging, and tertiary packaging. So each type of the packaging have the protective in different way. Like the primary packaging have to have a protective on the moisture, on the pest control or contaminate with some other things. But for the secondary packaging, maybe easy to open or convenience. And the third one will be like for the transportation from place to place. So you have to consider one by one from primary packaging, secondary, and tertiary. But altogether must be comply with the FDA in different degree. Like in primary packaging, have to be very high degree comply with the FDA, but the other maybe less and less. But for the transportation packaging, will be put on the trace, track, and control. When you design, you have to think about the total supply chain of your product. So this can be minimize waste and minimize cost also.
Yeah, so the protection is very important nowadays because Khun Vanna already shared that the e-commerce buying pattern is increasing. So meaning that the logistic and distribution is very important. If you are patients and you want to buy medicine for your kids or your mother, father, you don't want to see the packaging that's already destroyed because that is the medicine. So you will not take risk in taking those damaged packaging. Even inside is not damaged, but who gonna guarantee? So the protection of protective packaging is another thing that the manufacturer has to consider even higher because of the social distancing and the pattern of purchase of customer nowadays on the e-commerce. And even the hospital, they have already provided packaging by SCG that Khun Vanna already shared in the presentation that have to protect. I would say that this is the very interesting thing which we will bring to you in the near future on checking on the good distribution practice as well that cover on the good packaging for the pharmaceutical products. So now come to next question ka. How do you think about quality concern for pharmaceutical packaging? What will be the aspect on the quality for the packaging?
For the package design for the pharmaceutical, the concern is so high because every step that have to comply with the country regulation. Like in Thailand, is องค์การอาหารและยา something like that. But for the internationally, it's about the FDA. So you have to follow the law. Even like as I told you that for the last slide that I put it on, they talking about the selection of the material and protection, contamination, kind like that. So this is very important for the package design. For the pharmaceutical, and the most important, the other thing that you have to concern about the prevent the trial. So this one is very important because the children don't know which one can be eat or cannot eat. So sometimes they want to play or run around or take it out, some kind like that. So it's very important. And also the package design, it's a good design should be like appealing to the target also. Like this one is for kids, this one is for elderly, or even like for the herbal product, we should put like some picture of the herbal into the package design. So it's very easy to communicate and then easy to like pick up or easy to attract to the consumer or even like for buyer also.
Yeah. So now there is very interesting question ค่ะ follow by your answer on the packaging should be appeal to the target, right? On your number 9, I think. And then we all know that packaging will attract consumer to buy or even appeal to the right consumer, whether it is for kids or for the older. There is a question from the audience. It's very interesting that the target market of the child pharmaceutical actually mother and father. How you think about how to deal with that in terms of the appealing to the target, because the target is actually the mother and father. But you just answer now that it's about the usage. May I ask you to explain a little bit more to the audience who raised this question?
This is very good question because for the medicine for kid didn't buy it by themselves, right? Mother and father is the one that buy the medicine or that kind of the product. So but the packaging designer should be like make fun with like make the product or package should be like very attractive, because actually I didn't put on my side. Last few years, Thai student got the award, the first prize from Japan. She designs the package for the kid that very interesting one. It's like can turn and twist by the kid, and then the kid can play around with that package. So it's very good fun. But when the designer did the designs for, I think for the industry, so how to attract and how to make the user interesting into the product. So the package could help. Maybe some kids don't want to eat or drink the medicine because maybe it's quite like it's not sweet, it's maybe sour or kind like that. So or some kind is maybe a little bit bitter. So the design could help the parents to persuade the kid to try the medicine, and then they will get better from the illness. Yeah.
All right. So that I think that will be about 3 questions for the next 5 minutes. The question is about, can you compare the advantage between the glass packaging and plastic packaging for the herbal medicine? Which one is better?
Yeah, it's also very good question on the herbal product, because right now the herbal product is quite popular among the working class. I mean working consumer class, because sometimes it's like to relieve pain or to have some vitamin or nutritional products, kind like that. So this one is quite good. But the design for each one, you mean the question is about the design, right? So I mean it could be like represent or what is inside, kind like that. What inside, and have to be like some information inside, or even like on the package, and some recommendation for doses use, kind like that. Because the good packaging design for the pharmaceutical is for prevent overdose from the consumer also, because for the medicine or for the herbal product, if we take more or than over the dose, it may not good for their bodies, kind like that. So but the color, the color also very good for implement into the herbal product. And material also important. If we compare about the glass and the plastic one, the rigid plastic, we can see that in the market right now, not many is in the glass, but the glass have a very good property into maintain the quality of the product inside, and the medicine inside, or even like the herbal inside, will not change the color. So and this one, but right now a lot change from glass to blister, and also to the plastic, rigid plastic one, because of maybe lighter, and it's not breakable, kind like that. Or even like some is put on the blister, because blister we can take it out one by one. If like when you open the bottle, some kind the moisture can get in through, a kind like that. So we consider about this one. So the trend is changing from glass to blister, and so also for the plastic packaging also. Yeah.
Okay. So I would add a bit, if you can see from the convenience store, like the mini mart in Thailand, many of herbal products start to adjust themselves to be like one-time user, because some of the herbal medicine people use even once a month. That is the thing that we can see the trend. So I would add to Kun Vanna that the recommendation depends on what you want to position in the market as well.
Yeah.
So the next question, this is interesting one, because what you are saying is like have to invest a lot on the new technology to do new things, whether a sustainability, checking the hygiene, and even the design for the packaging. So how can the company reduce the cost in implementing the new technology? The audience must worry that it will add up the cost, because the cost is the first function I think you mentioned here, have to be reasonable price.
So things, I mean, many things, many ways or methodology to reduce the cost, but you for the pharmaceutical product, you cannot compromise with the quality. So the quality must be come first, and how to maintain the quality of the medicine, or even like a herbal product. But when you do the designs, you have to look at the holistic one. Yeah, from material, design, shape and form, design function, and look at the logistic total supply chain, so you can reduce a bit on the layer of the packaging. And also if you take a look at the function of each product, you can design the product that can be like fit with your product, and maybe after use you can use it for another function. It could be. And some design can eliminate the material, because as I told you that there are many innovation on the material designs that could be like lighter but stronger, kind like that implement in all the substrate, like glass, metal, plastic, or even like paper. So this is the way to like do the cost saving. Or even like when you do the design, you can just arrange the configuration of the package inside the outer carton. It could be reduce the price or the cost of the package also. So it depends on which one that you're gonna choose. So it's have a many different way. But one thing that most of the designer think about the sustainability. So do the right thing at the first time. So they will choose the right material and the right designs for the packaging, for the pharmaceutical and also the herbal product, because those industry must be qualified to pass the FDA, or even in Thailand have to pass OYO also. So this is we cannot compromise with the quality for the packaging designs for the pharmaceutical and herbal product.
All right, so come to the last part of today webinar. I would like to again introduce that Kun Vanna is from Thai Packaging Design Association. I would ask Kun Vanna to introduce about the association and the service that association may give you, like consulting on designing your package for your herbal products or even medicine product, please.
Yes, for the Thai Package Design Association, we established with all the designer in Thailand. This one, our mission is to help even like SME or all the manufacturing or even like a brand owner to implement the package design into their product. Besides of that, we help to sharing the knowledge with the industry, also for the education sector also. So, and we did have design consult for all industry. Okay, yes.
So apart from the Thai PDA, we also have our supporter from Thai Packaging Center from TISTER under the Ministry of Higher Education, Science and Research and Innovation. Sorry for that. So right now we come to the end of the today CPhI Southeast Asia webinar week. So for tomorrow we have the stay tuned for the we have the topic on the market trends for the herbal products. Unfortunately, it will be in Thai language. So for those who are interested, we are finding the solution to provide to you in English version. Our staff will contact you directly for the version of English. So we are trying to find a way to serve. I saw a lot of inquiry to do in English as well. So stay tuned with us. We will let you know. For today, I would like to thanks to Kun Wanna for her presentation. And I would like to inform you that I could not put all the question here. You may email to our Informa Markets team staff that put in the chat already for the question to Kun Wanna. And you can see the rerun of the webinar today in CPhI Southeast Asia Facebook. I would like to say tomorrow stay tuned with us at 11 a.m. Bangkok time. The speaker will be Mr. Sek Ratchatakan from the Medical Plant Research Institute, Department of Medical Science, Ministry of Public Health. See you tomorrow. Thank you very much and ขอบคุณค่ะ